everyone, as you've been following my journey, and thank you for all the support, I thought I'd give you an update on my mental health, and I guess we can call it recovery now, as you've been through the crisis with me over summer where I've really struggled, and I've had the crisis team, or they're called the home base treatment team, i.e. they try and give you hospital treatment at home instead of admitting you to hospital, which obviously suits me a lot better, with also contending with having 2 children to look after this summer. So I really do appreciate all the lovely messages, and I'm sorry if I've not replied to everyone yet. As you can imagine, I've just been focusing on what needs to be done. But the good news is that I'm preparing for being discharged at the moment. I'm waiting to hear from the crisis team when that will be, and I have like a handover with my community mental health team, and they're the ones who normally look after me. But then they pass it over, if you get to crisis point and it gets really bad, and then you get passed back to them. So that looks like it's imminent, and it feels like a cause for celebration, and I do feel so much better than I did even just a few weeks ago. It's quite incredible how you can turn such a corner from death's door to then kind of starting to see a future again. But there is something funny with discharge, and it's made me think of, now that sounded weird, there's something funny with discharge, not that kind of discharge. I mean, from any healthcare, there is something difficult with it, because you get used to the support. So whether that be you have 6 lots of counselling sessions, or you have a course of any kind of treatment, when that treatment comes to an end, for whatever reason, it's quite a hard process, because you become so used to that treatment that you struggle to see what life was before that treatment, especially if the treatment's been good. If it's been bad, then you're kind of just relieved, and life will be better without it. But I've been really lucky this time, because most of the crisis team have been so good with me. They've really treated me like a human being and like an adult, rather than just a thick person who's mad as hell. And I am mad as hell, and I am a bit thick, but I do like to be treated like a human being and an adult. So it's just a really funny turning point. So you'd probably think it's just cause for celebration, but when you're in it, you get quite used to the intensive treatment, even though you don't like it. It's a funny turning point at the moment. It's all good, but it's just getting used to it. So I just thought I'd give you a little update, and as ever, I've probably rambled on. But if you've got any questions, maybe you've got a loved one who is having mental health support at the moment, as a peer-to-peer person, I will happily answer your questions. But I'm not a professional, I must say that. But yeah, please do like, comment, subscribe, and I'll see you very soon.